Welcome to Creating Presence. I'm Dr. Sandra Bloom, and I'm here with my co-host, Sarah Yanosy.
Hi, Sandy. Hi, everyone.
Hi, Sarah. Sarah and I have spent the last 25 years working with leaders across the United States and around the world to build trauma-informed workplaces and transform service delivery for nonprofit, government, and for-profit organizations that really exist for the purpose of helping people. In this podcast, we share our insights, our experiences, and our knowledge in the hopes of inspiring leaders and other professionals to put these ideas into practice.
Today, we're going to describe the concept of double loop learning and how we integrate that skill into a practice that we use in creating presence called changing thought habits.
We usually do, on an everyday basis, what has been called single loop learning. And that means we make some basic assumptions that we don't even think about. Then we make decisions, and then we act, and we see what happens, and then feed that information back into whatever adjustment we're going to make. But the problem is that those assumptions that we start with are actually based on our mental models, deeper, often way deep ideas about how the world works. So in double loop learning, what we do is we question whether those mental models are accurate or are fully described, and therefore whether or not we are actually making the right assumptions when we begin a decision-making process. So double loop learning really makes us focus more on the why of an issue, not just the what are we doing? And the most important thing to think about, to be on the alert to keep your ears open to, around there might be a need to do double loop learning and to stop the process and kind of step back, is whenever you hear the word just used as an adverb in English, because it tends to be an excuse, without people even realizing it, for substituting a simple answer to what is actually a complex question or a complex problem. So double loop learning is an educational concept and a process that involves getting people to think more deeply about their basic assumptions and their beliefs. It was first described by a organizational development trainer named Chris Argyris in the mid-1980s. And it was developed over the next decade into a really effective tool, but you don't hear about it very much. So we want to bring it back and highlight how important this is.
So double loop learning is different from single loop learning, really in kind of a parallel to the way that when we did our first podcast of this season, we talked about changing the fundamental question from what's wrong with you to what's happened to you. Double loop learning kind of does the same thing. It changes the question from are we doing things right to are we doing the right things? So I think, one of the ways that I've heard this described that's really effective is to think about the analogy of a thermostat in your home, right? So single loop learning is about achieving the expected outcome. Like if you set your thermostat to 68 degrees, the heat will pop on anytime the temperature goes below 68 and it achieves its goal. That's single loop learning.
Now, if a thermostat was going to do double loop learning, it would have to be able to ask, why am I set to 68 degrees? And then be able to explore whether or not some other temperature might more economically achieve the goal of heating the room. That would be double loop learning. So of course you have to be a living being with cognitive function able to do double loop learning. because it calls for changing the objective itself. So double loop learning isn't only about changing the objective, but it involves questioning the assumptions about that objective, the ways of discovering and inventing what can be really new alternatives, new objectives, new perceptions, as well as ways of approaching problems that exist.
So let's move from thermostats to leaders, since that is really what our podcast is about. And Henry Mitzberg, he wrote that every manager has a mental model of the world in which they act based on experience and knowledge. And so when a manager has to make a decision, that manager thinks of behavior alternatives really that are just within the existing mental model. And that's single loop learning. So for example, if you're doing a workshop or, a training for a group of managers on high involvement management, and you're doing this in an organization that's kind of bureaucratic, hierarchical, which most of them are, we sort of have to start with the basic acknowledgement that the managers who've worked in that kind of system for their whole careers, they're not likely to, think outside of that process. So they've been institutionalized in an analytical, linear, and what we might even call a non-learning mindset. So they might be open to new ways or methods or techniques that support what they already do, which is single loop learning, but they're likely to get defensive if they're questioned about the underlying assumptions beneath their current practices, which is what double loop learning calls for. And I think that I see that often when we're implementing creating presence.
Yeah.
There's sort of a defensiveness around like, well, what we're doing already works pretty well. Why are we changing it?
Yeah.
And
This is exactly the problem that we're encountering, I think, everybody, everywhere, in every system, about teaching about what trauma-informed services really means. Because what will happen when we talk about, well, your system needs to become trauma informed. They go, okay, so we'll train the clinical staff. We'll give them a couple-hour training, and that'll be enough. And oh my goodness, that's single loop learning. And it's not enough, because becoming truly trauma informed and trauma responsive means that everyone at every level has to share some basic knowledge, but they really have to challenge their own basic assumptions about their clients, about other staff members, and often most critically themselves. And they have to learn and really think about themselves, not just in the present, but what has happened to them in the past. And that's what double loop learning is. And that's why actually becoming trauma informed requires double loop learning, and why we're spending today talking about it, because it's so critically important, and it's many places it is not happening.
yeah. And, we really highlight the importance of leadership engagement in creating a trauma-informed organization. And so those leaders are the ones who are not just kind of dictating that this is what we're going to do, they're also charged with role modeling and helping with educating their staff. And so double loop learning really is about kind of influencing thinking and behavior so that we can be more effective. And this period of time in, our history, where organizations that provide services to people, kind of organizations that are geared towards helping others, are really crunched. And that makes this transformational kind of process even more important now than it has been in the past. So the intention of double loop learning is transformation. Transformation of our organizations, but also transformation of deeply held perspectives about the world and sort of questioning some basic assumptions. And it's a distinct educational process, strategy. And it offers a lot of potential to shift the perspective of our learners. So let's talk more about that.
And I want to underscore what you just mentioned, which is the importance of this transformation that has to occur. And it has to happen rapidly when our lives and the climate, our very earth is really in danger. So the strategy or the method used to get to deeper learning is really a form of communication. It's a dialogue that involves a lot of interaction among learners. And it really is the idea that the educator has to drill down into a topic in order to identify and then bring up to the surface the things that are just taken for granted assumptions that people haven't actually talked about, but that are deeply embedded beliefs that are often passed down from generation to generation of workers, generation to generation of in families. And deeper loop, double loop learning helps people to look at that and to really integrate new information and develop new skills so that we question ourselves. And maybe we, in the process, get rid of familiar, but actually ways of thinking, feeling, and acting that have actually become really dysfunctional.
The way that you're describing this makes me think about how frequently we encounter, groups and organizations who are sort of stumped when I say, okay, so why do you do it this way? And the answer I get is often like, well, that's just how we've always done it. Um, but as times change, as the clients we serve change, as staff changes, and our systems change, sometimes they are no longer functional. And so using double loop learning allows us to kind of explore those taken for granted ideas that we have about our organizations or what works. Because sometimes we're doing that not based on evidence, but kind of based on familiarity. And it's also really focusing on communication. And that communication requires a lot of sophisticated tools. And we teach some of those in creating presence. But we also want to look at like some of the atypical ways that we think about communication, right? When we generally talk about it, we're thinking about the obvious, like email and phone, department meetings, that kind of stuff. But there are definitely less obvious forms of communication that we're not usually identifying or talking about.
Yeah, like, for example, the routine bureaucratic processes of management, management systems of information and authority, budgets, evaluation and appraisal systems, databases, all of that are actually communications. Even less obvious include statements of visions and mission and values and policies. So all of this, the terminology involved in this kind of communication can result in what's called a myopia, right? A real dimming of vision in which people don't see the other aspects of the wider process of communicative interaction in which they're actually participating by just going along with the established policies and procedures and not even questioning.
Yeah, we also, I think, sometimes forget that communication happens in relationship, and relationships are inherently constructed in power dynamics. So, the presence of leaders, the way people think about their leaders, kind of the fantasies they might have about whether they're, you know, benign or aggressive, that sort of stuff also affects the process of communication in any given moment. And so double loop learning is really helpful in leadership education because it kind of highlights that, it extracts that tacit knowledge, and makes it more overt, or explicit. And so it's a better way to understand the ordinary, the things that happen every day, to question our everyday working world and to think outside the presumptions and limitations that we have. Sometimes those are unconscious and they're constructed in our own minds.
We found that this was exactly what we had to do when we started to understand our patients as being survivors of trauma and adversity. That instead of just, before that, what psychiatry uses, as you know, is the diagnostic and statistic manual, whole bunch of symptoms, and then you put that into a diagnosis. But there was no room to actually ask, well, why is the person doing those things? What happened? And we found that we had to really use a very different kind of inquiry with each other that was really first talked about in 1978 by Chris Argyris and his colleague Donald Schoen. And that a kind of dialogue that questions the validity of the assumptions that we're making, and including our beliefs about what it means to be a leader. So the leadership educator has to develop really critical questions and guides, and guiding the learner through this change in inquiry process, which gets underneath the starting perceptions about what it really means to lead and to manage, which is really different in a different, a more living system model. So learners have to ask why we hold the positions that we hold and what we mean by them. And that may lead to asking what factors really have gotten us to that point, to adopt a particular set of standards for leaders and for each other, that actually may be really contradictory and may be contradict our basic values and beliefs that we have now, and the rationale we use when adapting these kinds of beliefs and ideas.
Yeah, I am thinking about the application of double loop learning for leadership, right? Like leaders engaging with other leaders and staff. But I think it also really has a lot of application to our work with clients, or patients, depending on who we're serving. And I use it in supervision too, because I think coming to a place where you start by asking, what has it been like for you before? What's worked and what hasn't worked? When have you had, experiences that have been really fruitful in your learning or in your change process? And when have there been failures? And then, sort of using that information to structure new strategies or take the risk to try new things. And that helps establish new norms, right? That feels a little risky, because we're giving up, right? There's a little bit of loss because we're giving up what we've done. And even if it hasn't worked, we're familiar with it, we know it. But this is a really powerful part of role modeling, positive risk taking. And I think too, when we think about it in communication terms, Argyris and Schoen said, good dialogue is not a matter of smoothness of operation or elimination of error. On the contrary, its goodness is inherent in the ways in which error is continually interpreted and corrected. Incompatibility and incongruity are continually engaged, and conflict is continually confronted and resolved. So again, it's like that relational piece rather than the delivery.
So important. That's a wonderful quote because it kind of sums up the change that is really embodied in trauma-informed services. A key aspect of leadership education is that everybody has their own definition of what it means to be a leader, usually coming from our own experience beginning in childhood. So it's most often at a tacit level. It's not, we haven't really thought about it. It's not conscious as such. We just do what we do. We all know what a leader is, but it's hard to find good definitions and explicit knowledge. So in the educational context, everybody participating, unlike in chemistry or math, have to come and they come in with assumptions and beliefs that become actually part of the learning center. There's no, in math, there's objective reality, right? You can only interpret the numbers in so many ways. But in what we're talking about, there's, almost an infinite way of interpreting what it means to be a leader. And these assumptions and beliefs we make can be extremely strong and make double loop learning really difficult to engage in. And it can feel to somebody in a leadership position really threatening. What, you're telling me I don't know what to do? After, I've been a leader for 10, 20, 30 years, you're telling me I don't know what I'm doing? That can feel pretty insulting. So I can give a good example of this. When you're learning psychiatry, you learn to think about a number of diagnoses that I referred to a couple minutes ago that all have specific symptom pictures. And that's supposed to guide you in what medication you prescribe, in what treatment you adapt and adopt. But in that system, the idea about people actually recovering, actually getting better, is not clearly presented to most psychiatrists. Maybe improved, you would expect to see if you're prescribing the right medicine improve, but the fact that they might get better and not need medicine anymore, not a real active conversation. So when you begin to see patients, mostly what you do is single loop learning based on that system. But once you learn about the adaptations that people make to trauma and adversity, that changes. And you need to start to really color outside the lines and spend a lot more time figuring out with the person what happened in the past that may have been the genesis of their symptoms that began as adaptive coping skills, but have turned into a significant problem. And once you start down that road of double loop learning, well, everything changes.
Yeah, I want to give an example, I think, that might sort of put this in like practical terms, and this is an example actually that you've shared with your students when you teach class about this. If we think about a adult woman who's admitted to an inpatient psychiatric unit, and while she's there, she tries to cut herself repeatedly, and the staff notice that she has scars from previous episodes of self-harm. And the attitude the staff generally presents with is that she's doing this because she just wants attention, right? And highlight the word dust. Exactly. So that's how we know, okay, this is single loop learning. The assumptions that the staff are making is that people will hurt themselves in order to get attention from others. And single loop learning results in the identification that like ignoring her and getting her out as quickly as possible is the right strategy and will lead to the best outcome, right? Like, oh, she's just attention seeking, so we should just not give her the attention. And that assumption really colors how people interact. It will certainly color how staff would interact with that particular patient. But if instead And this is where, we're really seeing that intersection between trauma-informed knowledge and the practical application through double loop learning. If instead we ask, like, well, why is she seeking attention in this particular way? We're likely to discover that she has a history of childhood abuse, and that self-mutilation has become a way that she manages her overwhelming feelings and memories. And that changes how we might engage, and in many ways lead us closer to actually helping. Um, and also, I feel like when I use double loop learning and I sort of do that assumption questioning, actually feel more empowered. And so it's so much about how we engage with that person so that we can be helpful. But the benefit we don't often talk about is, as workers, when we use double loop learning and we are questioning those assumptions, we actually have more efficacy. The options open up, right? Instead of just, I have to ignore this, um, there are a whole host of ways that I can now engage.
And engage with the patient in how to solve that problem. I can give another quick example. A teenager goes into a store and steals some milk and bread and candy. So the attitude towards that child then is, well, he just needs to be punished, needs to be arrested and sent to jail. And that's what happens. This isn't his first offense. So he's sent to a juvenile facility. He certainly had committed a crime. These are observable facts, but the assumption is made that punishment is going to do something positive and will succeed in setting an example. Single loop learning implies that he stole, okay, and therefore he should be punished. But what if we ask why this teenager is stealing and we discover that he has a younger sister at home, has no food because his only parent, his father, had not come home from an alcoholic binge? Then it really shifts the whole thing of what you're going to do for this child, right? I mean, that's the change to double loop learning.
Yeah, and we can apply this with the people we serve, also with our staff and our whole organizations. So we will talk more about that when we come back from our break. Thanks so much for listening to Creating Presence. We'll be back shortly.
In a world with trauma, adversity, and mental health deficits, your organization may be feeling the effects in its culture. Recognizing the need for safe, productive, and values-aligned organizations, Creating Presence can help to develop a healthy, biocratic organization. In the Creating Presence training model, your entire staff will learn to value human elements that characterize organizations, learn values that are solution-based and supportive, and implement new skills which will create capable leaders to meet the needs of staff and clients. For more information, go to www.creatingpresence.net. Creating Presence is managed by Lakeside, your resource for trauma-responsive care.
Welcome back to Creating Presence. I'm Dr. Sandra Bloom, and I'm here with my co-host, Sarah Yanosy. We're going to continue our discussion about trauma-informed leadership with a closer look at two areas of policy and practice that we target for implementing trauma-informed practice. The first is integrating the concept of double loop learning by the way staff get onboarded. And let's talk about what we mean by teaching this skill we call changing thought habits. We start with framing this as a complexity management skill and reflecting on the ways that those basic assumptions might be getting in the way of actually finding complex solutions, assumptions that are really very common in helping organizations.
So this is part of what I'm doing in coaching. And this skill is practiced by identifying communication, operational structures, and decision-making processes that are really based on outdated models of thinking and replacing them with trauma responsive action, right? So we're moving from like identifying what the thoughts are that are driving current actions, shifting those thoughts, and then shifting the actions. And it's also based a lot on kind of recognizing the importance of systems thinking, which you and I have talked a lot about in our previous podcasts. So I highlight like 6 things that we want to shift. The first is the habit of replacing a person in order to fix a problem and analyzing the dynamics of the problem or the program instead and intervening at the system level. So the first is sort of like this thought habit we have that organizations are like machines, and that if there's a problem, we can just replace a part. The second one is this habit we have of looking for a right or wrong answer to a problem. And again, that sort of really aligns with that single loop learning method, right? There's one way to do this, and we have to find the right way. And instead, really thinking about subjectivity and complexity and using that double loop learning process to ask, like, are we even asking the right question? Are we even, trying to accomplish the right goal? The third is the habit we have of relying on our past experience to drive our current processes, and instead moving to using the scientific method, like constantly reevaluating and adapting and being more open to changing how we do things.
That one's so important because there's such an emphasis on evidence-based practice.
Yeah.
And yet, rarely do we, once an evidence-based practice is in place, you can't stop asking about whether it's working or not.
Right.
And yet that is frequently what happens.
Well, it also, gosh, Sandy, now you've got me on a tangent, because I think a lot about, that reliance on evidence-based practice, which I support. I'm a fan. I have nothing bad to say about evidence-based practice. But I also think that we miss the opportunity for practice-based evidence, right? That's what we're really talking about. Are we seeing evidence that it's working in our practice and use of it? And if it's not, then we need to adapt. The fourth is a habit of relying on this process of, assembling facts and thinking that they are going to just lead us to the right place, right? Like if we just put together all the information and then analyze the information, then it will take us where we want to go. And actually, what we want to do is work backwards. We want to understand and think about, like, what is it that we want? What's the outcome we're really looking for? And how do we bring that to fruition? How do we, create the future that we want? The next one is, oh, and this one, it hurts my heart because it's so common. It's, relying on a need to know practice, right? It's using information as power, withholding information from people who actually might benefit from the information because we're not sure they'll use it well, or, we don't trust that they can handle it. That happens a lot. And it's sort of, using this almost paternalistic frame of reference. I even saw, an example of this. Well, you've had examples of this. You lived examples of this. You did this where, you were closing a program, but you didn't want to tell your staff because you were afraid that it would really unsettle them, and you kind of wanted to wait until the last minute. I've totally done this too. But in a clinical setting, I actually saw a group of people debating whether or not they should have a group for kids who were adopted, or a group of, therapy group for kids who were sexually abused, because putting them all together and letting them hear their stories felt really risky, that somehow they might use the information against each other.
Yeah, and when I did that, when I was withholding information from everybody, trying to be protective, actually it created what we've called a collective disturbance, right? So that like everybody, without knowing what the actual information was, the real facts, everybody was acting out. All the patients were doing all kinds of things. The staff were breaking all kinds of rules, and I caused it. It was really that some emotions were there and were present, because emotions are contagious, but nobody knew where they came from. And as soon as people knew what was going on, all of that stopped. All of that collective disturbance was evaporated, yeah, like almost instantly. It's amazing when you see these forces at work.
Yes. So the double loop learning part of this skill, of changing our thought habits, particularly around the need to know process. One, the benefit is that information is actually a creative force for inclusion and for planning. And the risk of not doing that is that we replicate this dynamic of secrecy. And for people who have had trauma experiences, especially interpersonal trauma, intergenerational trauma, man, secrecy is so toxic, and you feel it in your bones. So it's exactly what you were just describing. And then the sixth one is really also a way of thinking about systems thinking. And it's about moving from a reductionist mindset that really values oversimplification, right? And I think a lot about the word just, like we just need to focus on this. The solution is really simple. We just need to do this, right? To one that really appreciates interconnectedness and wholeness, right? Thinking about the domino effect of any decision that we make, and really thinking about that comparison that we make to organizations as living systems like bodies, and really understanding what are the ripple effects going to be. So I, sort of name these 6 habits and their alternatives. And then I ask people, which habits are you most likely to engage in? And how do these thought habits influence your work with your team members, with your staff, with the people that you're serving? And then we kind of look at actions, right? Like, so how is this thought habit showing up in your interactions or in your decision making, in your actions of any kind? And how are you going to replace that, right? This is like CBT 101, cognitive behavioral therapy, right? How are you going to replace this thought over the next month? And what will it look like if you put this into practice, right? Because we also want to identify there are going to be losses when we change anything, including our thought habits. We're giving up something that's comfortable or familiar. So that's what this process looks like when we're using that skill and integrating double loop learning and creating presence.
Well, staff onboarding refers to the process of bringing new staff into the organization. And from the point of view of interviewing for a position to the completion, really, of their probationary period, that's what we mean. So we have a list of questions to consider in better aligning that onboarding process as a trauma-informed practice, because it's going to determine much of what the new staff member experiences from that point on. So some of the things to think about in the very early stages, in the hiring stages: who's involved in the interview process? Are team members, or therefore potential peers, included? What is communicated about the people they're going to be working with, the clients? What language is used to describe them? What are the expectations that are being communicated about what qualities are going to be assessed related to the capacity to use a trauma-informed approach in the work? Do they know anything about that? And then there's once, okay, so they've been hired. Now there's an orienting process, right? Orientation. So how is that conducted? Who does it? Who does the orienting process? How is the organizational culture described? Where might there be gaps between what new staff are being told in the orienting process and then what they actually experience once they're in the organizational culture? And when and what do new people learn about the adoption of trauma-informed care through creating presence? When do they receive the training? When does it start? When are they incorporated into the process?
So I want to contextualize this too a little bit. The reason that we're making this connection between double loop learning and changing thought habits and this onboarding and bringing people into the organization, we know that the way that we embed trauma-informed practice has to be not just with the current staff who are there, right? And we've said over and over and over, this is not just about training and knowledge, it's also about action. And so in our coaching with creating presence, we're really looking at policy and practice opportunities to weave this in. And when we are bringing new staff in, this is a perfect opportunity, right? Because we want to make sure that we're making the right hiring choices and that the folks that we're bringing in when we do hire new people are coming into a culture that's going to bring them along and that they're going to be able to contribute to in a really positive way. So that's why we focus so much on what we're calling kind of the onboarding process, right? And so onboarding includes hiring, orientation, beginning employment, probationary period. And you just talked a lot about the hiring part and the orientation part. I want to talk a little bit too about beginning employment. And where I think there's so much opportunity for positive integration of trauma-informed practice and where there's also a lot of risk is kind of that beginning phase when people, all right, you've got the job, you're going to be working here, you've gone through orientation, you've heard all the things about how we operate and what the expectations are, and then you go in and you have your first day. And so we ask our organizations, how do you bring people in? What's the process? Do they have a mentor? Do they have, are they just given the staff manual and told like go read it, and then that's how you are going to do your work? We want to ask a lot about what's communicated about how to seek help or direction, so that staff members feel supported and know what they're supposed to do and how to get help if they struggle with that. How are they introduced to the expectations about trauma-informed practice in their role? What does that look like on the ground? Are the other people on the team role modeling that? How are the expectations about expressions of identity, things around diversity, equity, inclusion, and belonging communicated? Right. So most organizations have a team, right? There's a DEIB team, and they're doing a lot of work. But what does it look like on the ground? What are they walking into on their first day? And then during their probationary period, what are the expectations for performance and how are those communicated? How will someone know if they're doing a good job? And I go back to thinking about an organization that I worked in for a really long time. My first day of orientation was TCI training, and that stands for Therapeutic Crisis Intervention. And at that time, a good portion of that training was about restraints and therapeutic holds, how to manage safety that way. The message I got when that was the very first thing they taught us was like, oh, okay, controlling the patients and making sure that I know how to like keep them from doing anything that's going to destroy property or, that hurt themselves. Like that's my primary responsibility. And yes, patient safety was definitely the top priority. But having that happen first really, and like knowing, okay, this is how I restrain someone, it sent a message. And it wasn't the message that was intended, right? Because using therapeutic holds, restraints are a last resort. But it just so happened that the person who does that training was only available on Mondays. So that's why we did it first. It was a really inadvertent way of communicating values that were actually not aligned with the organization's values. So being really clear about like what does good work look like and what defines success? What's communicated about priorities for the role, right? Both explicitly and implicitly, like, my mistaken belief about, the importance of restraints. How is performance feedback given during this probationary period? And who does it come from? Are your peers expected to let you know if you're doing a good job? Is it just your supervisor? How do we build good communication loops about what's going well and what's not? And then, what's the new employee's experience of onboarding? What do they feel about what they're learning, right? That feedback loop. It's not just one-way communication. It's also, okay, so what did we miss that you should have learned before, you started in this probationary period?
And now the probationary period is over. Now you're working, and then what will occur is performance evaluations. So most organizations have some kind of standard template that they use. It's most likely a boilerplate template, and you might not be able to overhaul the document completely because it's so bureaucratic, but there are often ways to work goals around trauma-informed work into the process and getting it more in alignment. So it's the kind of conversations that really support trauma-informed performance that really mattered. So demonstrating effectiveness in job requirements, completing job-related tasks, asking for support, and continuing education. Do people do that, right, on the job? Are they reliable? Do they contribute in team meetings and take ownership? Are they able to manage their time and demonstrate timeliness and attendance? Are they really paying attention? And then can they take initiative? Do they seek feedback when they're not sure about everything? And do they volunteer for tasks and for committee work that's really necessary to get the job done?
Yeah, these are things that, may or may not already be part of the evaluation, but I think, when we are trying to embed trauma-informed practice and creating presence, as a framework for doing that, we want to think about, what's important in the evaluation of someone's performance and how do we connect that to trauma-informed practice? And these are some of the demonstrations of that, the things that you just named, like seeking feedback and contributing and taking ownership. We also suggest making goals around demonstrating commitment to effective communication. And, that's one of the skill areas for creating presence, the skills all around communication. So are we using active listening, consistent and clear written and verbal communication, maintaining confidentiality? These are some of the things that we might want to highlight. We also want to think about role modeling as part of trauma-informed performance evaluation. Are you contributing to a positive work environment? Right? Are you disrupting or abstaining from gossip and bullying and harassment? These are some of the things that we might talk about. The other, I think, around role modeling is, representing the organization formally and informally, in a respectful and professional manner, thinking about what your, actions and behaviors are doing as a reflection of the larger organization.
And then you want to assess the capacity of the person for planning and organizing. Can they accurately estimate how long a task is going to take, how hard it is, how long a project is going to take to get off the ground? Can they set goals and objectives and work plans and do the work toward completion? And that means having schedules and being able to prioritize days appropriately for meetings and client appointments, and being well prepared to get to meetings, and maintaining an organized work environment. It's having people that you are part of the assessment is that they're organized enough to make everybody's job possible. Because people that are really completely disorganized make it very difficult for everybody else.
So in addition to kind of thinking about what does it look like to practice in a trauma-informed way, and what are some of the things that we might want to evaluate, we also want to think about the process, right? How are you evaluated? And I know, there are teams that I've worked with who have said, this idea of using a rating scale feels really awful. And there are some supervisors who say, well, I'll never give my employees the highest score because I always want to leave room for improvement. And employees find that really demoralizing rather than motivating, in my experience. So, there's a lot of stuff around that. And really what we're suggesting is that the performance evaluation process needs to be collaborative. It needs to reflect that commitment to partnership and the appreciation of power. So we have a list that we've made too of potential goal areas, and some of them, that really are aligned with trauma-informed practice. So some goals I've been thinking about, teachers that I'm working with. Some goals they might have are around supporting trauma-informed rules and consequences, or behavioral interventions, supporting looking at safety in multiple areas: physical, social, psychological, moral, and cultural. Role modeling engagement for their teammates to support trauma-informed practices. Other things might be more around organizational goals, right? That's kind of specific to their own performance, but it might be responding to or reporting incidents using trauma-informed language. Thinking about employing conflict management strategies in staff meetings, recognizing and disrupting reenactments. Those are some of the things that we might highlight as goals that really help people with their trauma-informed practice in their performance evaluations.
Yeah, we've learned that implementing creating presence requires staff to really have the knowledge and the skills they need to integrate, as you said, trauma-informed practice, what you actually do, into their work. And it's equally important to embed the language and concepts into everyday functions, including policy and practice.
So we also want to think too about in the performance evaluation, like what are people most proud of, right? We want to use a strengths-based perspective. And I always start my performance evaluation conversations that way. Like, tell me about your moments of brilliance. Tell me what you're doing well and what you feel really good about. Tell me about something, that you struggled with but pushed through, right? So using what we know about how people recover from and develop resilience from trauma and embedding that into our process as well. So thanks so much for listening to Creating Presence. Join us next week when Sandy and I will talk more about what it means to lead in a trauma-informed organization. You can reach us at creatingpresence.net or voiceamerica.com. See you next week.
Bye now.